Hey guys, it's Tori and I'm here with my last video for oral cares for mechanically ventilated patients. So we're going to do these cares every 2 hours to help prevent ventilator-acquired pneumonia for these patients. And the first thing you need to do is knock, enter the patient's room and identify yourself. And then you need to wash your hands and apply the appropriate PPE. Gloves is always a must. So once you apply the gloves, you need to assess your patient. You can get their vital signs. Look at them. How do they appear? Check the ET tube. Is it damaged in any way? Once you've assessed all these things, you can begin your oral cares. So we have this little handheld piece. It's kind of like the universal adapter. So this piece attaches to the wall suction, -100 to -120. Has an on and off switch for the suction. So first thing you're going to do is apply this Yankauer type suction catheter. It has a protective sheath. This attachment is going to allow you to get the secretions that are sitting in the patient's mouth. They're just kind of pocketing in there. It's going to help you to get those secretions out, so you're able to kind of move around the ET tube and get any of those secretions sitting there in the mouth. This covering is to help try to keep this as clean as possible. So you come back, it's been 2 hours, it's time for your next cares. You're going to attach the toothbrush attachment on here. You're going to apply some of the toothpaste solution and you're going to brush the teeth for that patient. You want to make sure that you are not being so gentle that you aren't getting the mouth clean, but you want to be doing a thorough enough job that so how do I say this? You don't want to be too gentle where you're not cleaning the mouth, but if you're too gentle, that's a problem. Also, if you're too rough, it's a problem because you might be causing pain or discomfort to your patient. So you have to find that fine line in between the two. So once you've cleaned the teeth, you turn on the suction, you suction out any of the secretions. Then you come back with this mouth moisturizer. You get all the internal surfaces of the mouth as well as the lips to make sure your patient's mouth is well moisturized. So it's been 2 hours. We come back, we have this long suction catheter. We turn on the suction and we suck those secretions that sit farther back into our patients' throats. With these patients that are intubated, they're not able to cough up or expectorate anything, so that's what we use. This is the attachment we use to help get those secretions that are sitting farther back into the throat. And then you come back, it's been 2 hours. We're going to use this attachment. It's sort of like a sponge on a bent tube. Has a hole in the end for suction. So to use this, it's very similar to how you use a toothbrush. You dip it into this oral debriding agent, which is just like a mouthwash type of situation. And you're going to clean the internal surfaces of the mouth. You want to get the cheeks, you want to get the gum line, you want to get the tongue, the roof of the mouth. Again, not too gentle, otherwise your mouth isn't clean. Not too rough, otherwise you're causing your patient pain. So once you've got the mouth clean, you turn on the suction and you suction out the secretions. You want to be sure that you're not sucking out the secretions. You don't have the suction on while you're cleaning, otherwise you're not getting the mouth as clean as you could be. So you clean the mouth first, then you suck the secretions. And then you want to come back and use the mouth moisturizer and get all surfaces of the mouth again, including the lips, the cheeks, the roof of the mouth, the tongue, etc., because you want that patient's mouth to be nice and clean. So once you've done your oral cares, before you leave the room, reassess your patient. Reassess your ET tube. Do you see any damage? Okay. Check out the integrity of your patient's skin. Do they have breakdown where the ET tube's been sitting? This is a perfect opportunity for you to look at the skin integrity. And so you should be checking these things each time you do oral cares on your patients.